Hello, good morning and good evening to all attendees. Thanks very much for taking the time to attend this seminar from the Open University Gender Critical Research Network. My name's John Pike and I'm delighted to introduce a very important and special speaker today, Dr. Holly Lawford-Smith, who will speak to us on hitching gender identity wagons to sexual orientation stars. Just to flag up our next seminar on the 13th of June at 1 p.m, where our own Dr. Laura McGrath from the Open University will talk about psychology and the origins of gender identity. But now I'll hand directly over to Holly.
Great, thank you. Good. You can't see yourselves over my slides, right?
I think it's fine as you are.
Okay, perfect. Great. So, as most of you are probably aware, many states and countries in the last few years have introduced or proposed to introduce conversion therapy legislation, which criminalizes attempts to change or suppress people's sexual orientations or gender identities. So here's just a version of the Victorian legislation. That's where I am. So if we're considering conversion therapy as a practice, and from a whole world and all of history perspective, then it's important to note that it divides into what we might call aversion therapy and what we might call talk therapy. So Peter Gaidich, in his memoir that I have here, but I think I also put it on a slide, yes, The Inheritance of Shame, he talks about his experiences with gay conversion therapy, and describes, for example, being directed to carry around like a small vial of feces and to sniff it whenever he has a homosexual thought or desire. So this is an attempt to recondition desire by associating it with something bad or disgusting. So that's just one example of aversion therapy. Such therapy can be often rightly described, and it might be a little small to see here, but this is a UN report which kind of describes these practices as torture. So such therapy can be rightly described often as a form of torture. But talk therapy, on the other hand, involves things like counselling, psychoanalysis, and prayer. So the context that I'm interested in is progressive countries like the UK and Australia, where aversion therapy would already be prohibited both by criminal law and by the professional standards of fields like psychiatry, and where there are already strong anti-discrimination protections for people with minority sexual orientations and for people with gender identities. So I'm interested specifically in the prohibition of talk therapies aimed at change or suppression of sexual orientation or gender identity in these contexts. And the thing I didn't point out, but which is like the premise of the talk is, as you can see here in the Victorian legislation, it's always sexual orientation or gender identity, sexual orientation and gender identity, never separate, always together. And that's kind of going to be the question. So in my own state, in Victoria, Australia, conversion therapy legislation came in as one of 3 bills in quick succession. So you see them here. And all of these bills had something to do with gender identity. So the first one is our sex self-identification legislation. The second one is the conversion therapy legislation. And then the third one, which didn't get up, was vilification legislation, which is our version of hate speech. And I think that sort of trifecta is what made me suspicious about the justification for including gender identity in conversion therapy legislation. So maybe if the timing had been different or the bill had been isolated, I wouldn't have given it quite so much thought. At least anecdotally, all of the cases of conversion therapy that I'd ever read about or heard about targeted sexual orientation. In fact, the only case of targeting gender identity that I could think of was fictional, so namely the two-spirit character in at the conversion therapy camp in this 2012 novel, The Miseducation of Cameron Post, which some of you might have read. So I decided to look into it. Another Australian state, Tasmania, was proposing to introduce conversion therapy legislation, and their Law Reform Institute produced an issues paper which included a section in which it looked at the peer-reviewed literature on conversion therapy. So that seemed like a perfect place to start. So we're already there. So what I did was review their review by reading the 35 papers that they had included. And what I found confirmed my earlier suspicions because, as you see here in this table, well, and with some further explanation, out of the 35 papers that they looked at, 34 of those were exclusively about sexual orientation. The one that was about gender identity, which is this paper number 34 by Wright et al., that was a meta-study published in 2018, and it reported finding only 4 papers about conversion therapy for gender identity. 3 of those were individual case studies that the authors of the meta-study described as being of overall poor methodological quality, and one of which described working toward desistance at a gender clinic as conversion therapy, even though much childhood gender dysphoria resolves itself naturally. So desistance is common. So it's not clear whether that was a fair way to classify it. So this first step of the Tasmanian Law Reform Institute's review is not my focus today. If anyone wants more detail on that, I have a paper under review that I'm happy to send people. There's also a short video version of that talk online, and I can send the link to John to distribute or put it somewhere. So I'm just telling you about that step in order to explain my starting point for this talk. That is, the most natural explanation of why conversion therapy legislation includes both sexual orientation and gender identity would be that conversion therapy has been done or is being done on the basis of both sexual orientation and gender identity. But that does not seem to be the case. Of course, it's possible that there is a lot of it going on, but no one has studied it. So there's a phenomenon in the world that isn't being tracked or caught in the literature. But I would say, given the great interest in trans issues at the moment, that seems pretty unlikely. So it seems to me that there are 2 explanations left. One is that gender identity is like sexual orientation in some important way, so that we should expect them to work similarly. If conversion therapy for sexual orientation doesn't work, then similarly, we should expect it not to work on gender identity. If conversion therapy for sexual orientation is harmful to those subjected to it, then similarly, we should expect it to be harmful to those with gender identities who are subjected to it. So it could be that there has in fact been no conversion therapy at all on the basis of gender identity, and yet still be justified to ban it, because if there were to be some, it would be similarly harmful. So the ban might be considered as precautionary or preventative. The other explanation, the third one you see here, is that the pairing would be that the pairing of sexual orientation and gender identity in conversion therapy legislation is moral or political. So it's not that conversion therapy has been done on the basis of both. It's not that they're similar in a way that makes it appropriate to ban one for whatever is banned for the other, to ban for one whatever is banned for the other. It's rather that it's important for some moral or political reason to always include one where the other is included. And the main thing that I want to do in this talk is explore that first alternative. So there's this middle idea by looking into the scientific literature on innateness for gender identity. And I think that would give us the kind of similarity that we'd need. If they're similar and similarly innate, then all the ideas about sexual orientation would apply over. Like that people are born that way, and that it can't be changed, so trying to change it would be harmful to them, and that it's society that needs to change, not the individual. So if I can rule that possibility out, that gender identity is like sexual orientation in terms of its innateness, then the field is clear to conclude that the pairing is indeed moral or political, and to then look at those arguments and work out whether any of them hold up. And of course, just to sort of anticipate many steps forward from this talk, as you can probably gather from the title of it, I think gender identity wagons are indeed being hitched to sexual orientation stars, so that all the cultural baggage of the ladder and all the sort of goodwill around the gay rights movement can simply be applied over as if by analogy to gender identity. And that allows a huge fast tracking of the implementation of gender identity ideology. But I'm not going to have time to establish that conclusion here. So our question is whether gender identity can be considered innate in the same way that sexual orientation generally is considered. Okay, so although I've introduced this topic through its application to conversion therapy legislation, there are many implications of whether gender identity and sexual orientation are alike. So here are some more. First of all, clinical approaches to children who say they're the opposite sex. So if gender identity is like sexual orientation and both are innate, then any attempt to change, convert, or suppress a child's gender identity is an attempt to change something that cannot be changed, and that may cause harm to the child to try to change it. So there is evidence that trying to change sexual orientations causes lasting shame and has a range of negative impacts on well-being. If gender identity is not like sexual orientation, then this framing may be preventing children from getting the care that they need. And clinicians speaking out on this issue have noted that even when a child presents with a range of issues, if there is opposite sex identification, it's generally assumed that gender identity is at the root of the other problems and that transition will resolve them. If this is false, it means the child's other issues are not being treated. Public acceptance of sex self-identification laws. So if gender identity is like sexual orientation and both are innate, then sex self-identification laws, which remove all gatekeeping of what legal sex category a person belongs to, would appear to be more acceptable laws. So the public will think that some people with male bodies really are innately female, and so should be allowed legal recognition of that fact. If gender identity is not like sexual orientation, then this framing may be undermining women's interests in having women-only spaces, provisions, and services by including some male people in them for inadequate or insufficient reason. Fourth, and I think this is an interesting one, there would be testimonial injustice to detransitioners and desisters as an implication of this parallel. So if gender identity is like sexual orientation and both are innate, then detransitioners and desisters are like ex-gays. So people who probably are actually gay, which is to say they have the innate feature whether or not they live in accordance with it or not, but they just don't want to admit it or live as it. So progressives don't put much store in the testimony of ex-gays when they say, for example, that you can change your sexual orientation if you want to. So this pairing of sexual orientation and gender identity permits the same dismissiveness about the testimony of desisters and detransitioners. If gender identity is not innate, then we are perpetrating testimonial injustices against desisters and detransitioners when we dismiss them. Next, impacts on safeguarding and women's boundaries. If gender identity is like sexual orientation and both are innate, then gender critical women really are just being horrible when they talk about the sexual nature of some pathways to trans identification, in particular autogynephilia. So Finn Mackay, for example, I forgot to get a slide ready, but here is the book. In her 2021 book, Female Masculinities, she writes that some opponents to trans inclusion argue their standpoint by suggesting that all trans women actually have what is called autogynephilia, an unproven and wildly offensive philosophical theory from sexologist Ray Blanchard. So of course, innate gender identity is a much more palatable justification for having men in women's spaces. Sexual excitement about being women is not. It's wrong to require someone to suppress who they truly are at work, if that's an innate gender identity, but it's not wrong at all to ask someone to leave their sex life at home. So it matters a lot whether gender identity is like sexual orientation, although this gets confusing because autogynephilia is arguably a sexual orientation. Second to last implication on freedom of expression, opinion, and speech, including in workplace policy, social media policy, and public life more generally. If gender identity is like sexual orientation and both are innate, then it makes sense to include gender identity as a protected attribute in laws against hate speech or vilification, at least in the countries that have these. It also makes sense for workplace and social media policy that has hate speech or vilification protections for other minority groups based on innate features like race and sexual orientation to add gender identity. If gender identity is not like sexual orientation, then this will have the impact of restricting speech unnecessarily, including legitimate feminist resistance to ideology that is against their interests. For one example, not being able to refer to the sex of men who have perpetrated violence against women and girls using sex-based pronouns on pain of violating policies against misgendering. And then final implication, I think, is schools socially transitioning children without parents' knowledge or consent. Again, if gender identity is like sexual orientation and both are innate, then it makes sense to think that there are only more and less accepting families of what the child really is. So schools affirming a child's gender identity without the parent's knowledge or consent can be a way to support the child and mitigate some of the shame and trauma that might otherwise have been created by a full suppression of their identity. But if gender identity is not like sexual orientation, then schools may be doing something that is against the interests of the child in the long term and in a way that assumes authority over decisions about the child's welfare that belong rightly with the parents. And by the way, I'm still collecting examples of implications here, so if you can think of one that I've missed, please tell me in the discussion session or get in touch with me afterwards. Okay, so final thing I need to say before we turn to the scientific literature on gender identity and innateness is that I'm really asking about the similarity or difference gender identity has to how we think about sexual orientation. So the current view is that sexual orientation is innate, and this is quite a swing back from, for example, the 70s and 80s, when it was more popular to believe that sexual orientation was socially constructed. So I'm making this assumption in the first premise that sexual orientation is innate for two reasons. One is practical. I just don't have time here to go over whether sexual orientation is innate and then compare the evidence for that to the evidence for whether gender identity is innate. I do plan to do that in the bigger and longer project that this talk is one part of, but I can't do it here. So I'm just focusing on the question for gender identity. And the other reason is related to the title of the talk. I think there's a hitching of wagons to stars going on. So the real question is, however we currently think of sexual orientation, is gender identity the same as that? Because I think it's this idea that's driving so much of the law and policy changes around gender identity. And at the moment, we tend to think of sexual orientation as being innate. Okay, so the literature. So there are 5 main categories of work on gender identity, or at least something in the ballpark of it, like gender dysphoria or transsexuality. I'll come back at the end to comment on the cohorts. These categories are brain studies, prenatal hormone studies, genetic studies, studies on comorbidities, so sort of correlations between gender identity, transsexuality, and so on, and other issues. And then work on childhood emergence and stability of gender identity. And then ruling out 2 of these areas in advance, as not being close enough to the question of innateness, which is the comorbidities and the childhood emergence and stability issues, because these categories both might have purely social causes or explanations. So say if we're dealing with something like anxiety or depression, that might be something caused by specific events in early childhood. Okay. So here is my first table, and I hope it is not too tiny for everyone to see. So these three sort of general categories: brain studies, most of the studies, and sorry, let me say first, down in the bottom left-hand corner is just a note for anyone that knows what they're doing in this area. This is not yet a systematic review. We've been sort of, a research assistant and I, feeling our way through learning the terminology as we go so we can find more papers and pull them in. I think this is probably quite a lot of it, but I'm not certain that it's all of it yet. So not a complete and comprehensive review at this stage, a work in progress, but I think this is quite a good chunk of it. So studies on brain structure, which tends to be things like volume of a certain brain region or weight or number of neurons, things to do with the technical aspects of the brain rather than how it works. So function would be something like map reading, for example. Genetic studies, so studies on the wider family members of trans or people with gender identities, twin studies, and then studies claiming to identify specific genes or bits related to genes. And then prenatal hormone studies, looking at specific kind of like hormones in prenatal development that may explain gender identity. And then a few general things to say before I tell you a bit more about some of these papers. The first is that quite a few of them, and certainly these ones that I've marked in blue, they're not actually talking about being trans or having a gender identity or getting diagnosed with gender dysphoria or gender identity disorder on the older diagnostics. They're talking about this thing that they call gender diagnosticity. So if you just read it quickly and see GD, you maybe assume gender dysphoria, and then it seems like it's we're on the right topic, but it's not. They are diagnosing masculinity, femininity spectrum. And of course, what that is, or what we would call that as feminist, for whoever else in the audience that applies to, that's just gender nonconformity or gender atypicality. So some of these studies are looking at the genetic roots of, or the prenatal hormone theory explanations of gender nonconformity. And some of them do a kind of interesting job of managing to explain that or predict quite a lot of variance in that. But that is not yet being transgender, or sort of that is not yet going to meet the conditions for gender identity disorder. So that's a kind of interesting complication there. Second thing I just wanted to say is, like, if there were like great results here, like, hey, it turns out that a male to female transsexual's brain is more like a female brain, or turns out in twin studies, any identical twin who's a trans woman, both will be a trans woman or neither will be. That's a sort of like super interesting, robust result. What you have across the literature is just like very, very different results in each category, mostly not replicated. So like there is interesting stuff in the brain structure category, but it's like 2 papers on the BST, which is the bed nucleus of the stria terminalis, so a particular area of the brain that does tend to show up big sex differences. So yeah, 2 papers found something there. A later paper looked at different regions of the brain that show up sex differences, the INAH 1 and 3, I think it was, or 2 and 3, and then they found a difference for transsexual brains being more like female brains. Someone else looked at grey matter, someone else looked at white matter. So you've got all these interesting, kind of usually small cohort, interesting and slightly promising results, but they're all about different things and they're usually not replicated. Similarly, in the genetic studies, there's a lot going on, and some of it relates to what I said already, that they're really actually not looking at gender identity sort of diagnosis or trans identification. They're looking at gender nonconformity. So even I think the second paper in the twin studies list, that Burry et al. 2012, it's announced as being about sexual orientation, gender nonconformity, and gender identity. But the thing that it calls adult gender identity is actually just adult gender nonconformity, and it's measured by questions like, how feminine do you feel? So again, like a lot of feminists might answer that, not very, and that has nothing to do with gender identity. So there's quite a lot of like mess across some of those papers on that point. And I'll say, I think I'll come back to that. Yeah, so let me just say something about the prenatal hormone studies. Similarly, quite a lot of different things going on. So again, some looking at gender nonconformity, but not gender identity, some looking at spatial ability, some looking at girls with a very specific intersex condition that have high androgen exposure prenatally. And then again, the same blue category, just looking at masculinity, femininity spectrum, rather than looking at trans identification. So I'm just going to tell you slightly more about a couple of those, and then just say some more general things to be critical about the categories in general, and then after that I will be quiet. So this is just the first papers in each list. So the Garcia, Falgueras, and Swab paper from the brain studies section. They're drawing on previous work. So two of the next paper down, the Kruiva, I don't know if I'm saying that correctly, paper, and then the Zhu paper. Those two showed this difference for the BST region, and again found that male to female transsexuals had a female-like BST. And then the Garcia, Falgueras, and Swab paper goes to the INAH3 and 4 regions. They didn't find a result for 4, but INAH3, they found female typical this brain region being female typical for male to female transsexuals. And they found that only some of that could be accounted for by a lack of testosterone later in life. So they had a control group of castrated males, and that castrated male group had the INAH3 region intermediary between typical males and typical females, but the male to female transsexuals had higher than that and in the female range. So from that, they concluded that there are prenatal effects of sex hormones playing a role in transsexual identification. And just to comment on the cohort there, this was post-mortem brain studies on 10 transsexuals. 8, but they use this word transsexuals, but then they say 8 of these people had had sex reassignment surgery and taken hormones. 2 had only had hormone therapy, and then a further 1, so 10 transsexuals, and then 1 further person who had a gender identity disorder diagnosis but had not taken hormone therapy or surgery. So that's quite a lot of different things going on under this kind of cohort label. Second, this kind of second, what's that called, column? Yep, the Green and Cavern paper. So again, this is drawing on studies on sexual orientation having genetic roots. So there had been this interesting finding that there were more aunties in gay men's families than uncles. They call that a significant skewing in the sex ratio in the wider family. And these authors wanted to find out, does that same effect show up in transsexuals? So they got a big sort of study of, I think it was 417 male to female transsexuals and 96 female to male. They looked at their families, whether they also skewed female. There was no difference or no interesting result for the female to male transsexuals, but there was a similar difference as we find in the sexual orientation case for male to female transsexuals. So there are similarly more aunts in the wider family. And these authors hypothesized that the explanation runs via a very complex story that I would not be able to repeat for you about genome imprinting. And again, they just say transsexuals. They're people who are recruited from a gender clinic, and the clinic is described as providing hormone and, so medical and surgical transition, but it's not specified who of the cohort are trans in what way. And then over in the top of the prenatal hormone study category, the Meyer-Balberg is looking at prenatal androgenization effects, but specifically and only on CAH girls, so girls with a specific intersex condition. And they found that in the middle childhood, those girls had more masculine behaviors than their peers, but did not have unusual gender identity. And they're using that in the paper to argue against the reassigning of CAH girls at birth to male. So in the time they're writing the paper, 2003, they say some people are saying, I guess because of the genital presentation of these girls, they should be assigned male. And the authors are arguing on the basis of their being perfectly happy with their gender assignment in middle childhood that they should not be reassigned male. They should be left to live as girls. So there it looks like the prenatal hormone theory, the higher androgenization in fetal development was plausibly causing gender nonconformity, because those girls were having higher masculine behaviors, but they were not having any sort of cross-gender identification. So the hormones were arguably causing gender nonconformity, but not causing gender identity. Okay, just a few, this is out of order, but this is just one of the papers in the twin category, the last one in blue there. And this is just to say, again, this was only about the GD here is the one I said is misleading, so it means gender diagnosticity. But they found in their Australian adult sample, for example, if you look on the top row in the first two columns, that's monozygotic male and female twins, so identical twins. And they found a variance just before 50%. So that's interesting, and it suggests some sort of genetic role for twins, identical twins, having the same gender diagnosticity. They're both highly masculine, or they're both highly feminine. But there's this whole other 50% to be explained, which can't be explained by genes or shared environment. So then there's a very interesting discussion of like, yeah, interesting idiosyncrasies and peers and life experiences that might then channel people to have these gender diagnosticity differences. Okay, so we had these three categories. We had all this stuff going on. Now let me just give you some like much more general reasons for skepticism that any of this is really going to pay off and deliver us the verdict that gender identity is innate. So a male can be sort of innately feminine or innately a woman or whatever. So on the brain studies, as I said already, they're mostly not replicated. For most of them, although this one that I told you about did have the castrated male control, which was interesting, but for a lot of them, there's a question about the direction of causation. So are we sort of assuming that the brain was there first and sort of drove the behavior, or the behavior came first and changed the brain, which is especially likely in the case that there's taking of cross-sex hormones at certain periods in life, and if there is castration. So there's this question about, like, same question that comes up for brain studies for sociopaths, actually, like, does the brain change through the failed use of empathy throughout the life, or was the person born with a certain sort of brain that lacked that function? The most damning criticism, I think, is that this whole idea of a male person having a female brain, right, or even if we narrow it to these specific regions, is that there has to be a male and female brain for the transsexual brain to be like. And it's my understanding of the more recent literature that just isn't plausible. There's huge overlap in traits between male and female brains. So there's going to be female people that have high masculine aspects in their brain, but that wouldn't count as trans. So you're not going to get a justification for counting the trans person as being the opposite sex on the basis of the brain difference, but not the whole rest of the typical population. And the maybe coolest thing about this literature is that Daphne Yoel, teamed up with Garcia Falgueras and Schwab, Schwab had been involved in at least 3 of the brain studies papers, and then Garcia Falgueras in this one listed at the top. And they applied her research on the brain mosaic, which is very much kind of debunking of the male-female brain idea and showing the high degree of overlap. And they showed that applies to postmortem transsexual brains. So when you look at transsexual brains, they're mosaic brains just like everyone else's. They have a mixture of traits. You can find some people that have more typically male, more typically female, and more mixed. So yeah, just like everyone else. reasons for skepticism on the genetic studies. Again, I think this just goes back to stuff that I've said already. A lot of what's being pointed to in this literature is really about gender nonconformity and not about gender identity per se. And then reasons for skepticism on the prenatal hormone studies is that there's missing correlations. So there's a really good discussion of this in, again, I forgot to do a picture, but Rebecca Jordan-Young's book, Brainstorm. And there's just an image here to kind of roughly give the idea. The thought is this work is also being done for sexual orientation and now more recently for gender identity. There are sort of all sorts of alleged connections that show up. So like, oh yeah, mothers exposed to this particular drug that was meant to prevent miscarriage. I can't remember what it's called. Diethyl something. But then, yeah, there's more left-handedness or whatever. Okay, so we get certain sort of causal claims, or CAH girls tend to be more likely to be lesbians or whatever. But she's sort of pointing out that for the theory to be robust, that this hormone burst is the explanation of this cross-sex gender identity or sexual orientation or finger digit ratio or whatever the things are that have been predicted, you would want a closed loop. So you should be able to get from the hormone burst to the alleged connected behavior to some correlation with at least one other thing that's allegedly caused by the same hormone burst, and then trace that back. And she says you can't. There's very, very limited cohorts for whom you can make those connections, like girls with CAH. They'll be more masculine, they'll be more likely to be lesbians, and you can explain the higher androgenization. But you can't do this across the board. You can't take the more left-handed people and trace that loop. And then final thing I want to say, and then I really am stopping, is just that, as should be obvious already, there's really big questions across this literature about what cohort they're talking about. And that will be familiar to most of us that have done work in this area as well. This question of who is trans? Like, what's the thing being tracked here? Gender nonconformity, transsexuality with reassignment surgery, gender dysphoria, whatever. So if they're not tracking the same cohort, they're not talking about the same thing. So I think this is roughly where we land. Probably the second claim that gender identity is like sexual orientation in respect of innateness is going to turn out to be false. So we're left kind of with a clear ground to go ahead talking about the pairing of sexual orientation and gender identity in conversion therapy legislation and in all those other areas I talked about implications for as being morally and politically motivated. And that will be the next step of the project. Thanks.
Thanks, Holly. That was great. If people with questions could raise their hand using the raise your hand icon, that would be super helpful. And I'll unmute you as I come to you. So Gillian, Spencer, hang on. Let me try and do this.
Oh, thanks for that, Holly. That's really fascinating. Is it tricky because we're sort of talking about innateness and then looking at the brain studies, etc., to think more about that, but there's no brain studies or that shows the innateness of sexuality, and I know we're parking that to one side anyway. Yeah. But to that point, like, there's no brain studies that can show schizophrenia or severe autism, and it probably just speaks to and when I say brain studies, I'm talking about the whole medical sort of diagnostic stuff that we're talking about when it comes to mental illness or behaviour. It might just sort of speak to the poor state of that, how primitive things are. We can't pick anything up on brain scans, maybe, cancer. But but I'm obviously as gender critical as the next girl, and I don't think we're going to find, some sort of biological basis for this, but it might be that we can't conclude that there isn't one because it's really a very poor state of the science. And my other thought was just in terms of innateness, gender medicine is something that's not comparable to any medicine I've ever seen. And we've never used innateness as a reason to treat or avoid treating. We have always used function and ability to thrive in life, I guess, is, you know, part of the criteria, occupational dysfunction, social dysfunction is labelling a disease. And then whether, but I didn't know what your thoughts were there in terms of whether is the issue the idea that someone will thrive if they transition, and so therefore we are sort of treating it as a functional thing. But yeah, innateness hasn't seemed to come into child and adolescent psychiatry as a criteria for treatment or not treatment. Thank you.
Great, thanks very much. I'm happy to just take the first point. I think, yeah, that might be right, that it's not a problem about gender identity brain studies in particular, it's a problem about brain studies. Yeah, that might be right. I guess I sort of thought that the most, from the reading, that the prenatal hormone theory maybe is going to be the most promising. The twin studies and family studies stuff looks, yeah, like that's interesting. They can sort of predict high amounts of variance. So that it's sort of, yeah, probably that's right. But the other two categories, if any one of those three is going to yield something, it's probably more likely one of those. The question about gender medicine and innateness is interesting. I guess I sort of, it's not that I think it's explicit that people are relying on innateness, but so much of the rhetoric sort of seems like it could only be well explained by that. So the sort of like children know who they are kind of idea, like it really points to this deep sense. I mean, I think Kathleen Stock called it like the what stick of rock model or whatever, right? It's like this deep core of the person, and they somehow, yeah, that they can only they can access, but that they know who they are. So I feel like there's a sort of folk claim of innateness in both how we think about sexual orientation and gender identity, and maybe just that it's better justified in the sexual orientation case, which is where I get the worry that there's a kind of free riding going on. So yeah, it's sort of, I think it's helpful to note that it's more about function, but maybe it's like, why did the parents assume that there's going to be terrible function if the child is not affirmed? Well, maybe that's because there is this background belief, like this is just an essential property of this person. This is a way that they could not be otherwise. And that's what justifies not trying to like aim for desistance or do watchful waiting. So yeah, I'm somehow very hooked on the idea that this is actually what's explaining a lot of things underneath.
Yeah, but we never do that for ADHD or schizophrenia.
No, and maybe we wouldn't for obviously dysfunctional or negative traits. The problem with trans identification is it's really caught in the middle, right? Because it can make some plausible claims like the problem is the society, not the person. And we're familiar with that structure of argument from being gay, right? So it's like, yeah, being gay is dysfunctional in a homophobic society. But of course we think the society should change and not the person. So it's like it's maybe sitting in this awkward space in between. It's not like a mental health problem where it's obvious that that's just making the person's life go worse, depending on the problem. So yeah, I don't know. I mean, yeah, I don't know what that really shows. Just maybe it's in a kind of, it's not quite clear which way to classify it.
Right, can I take Molly Gardner next? Molly, if you can unmute.
Yeah. I was wondering if you looked at any literature on whether paraphilias are innate, and especially autogynephilia.
I didn't, but should I?
Well, I mean, I haven't looked at it either, but I would suspect that it is. And then you'd have to deal with the argument that, well, you'd be in a weird place. I guess I'd want to know what would that say? How would that affect your argument?
Yeah, that's a good point, right? I'm sort of assuming that like anything innate, because I'm using innateness, but I'm also using similarity to sexual orientation. There's something slightly elusive going on. I think that's right, because it can't be just innateness, because some things that are innate are terrible. So yeah, I think that is a sort of imprecision that you've picked up, and I sort of need to figure out how to say it's the thing about what we think sexual orientation is like, that is letting us kind of do all this work just by generalization or analogy. It's somehow something to do with like who we really are, and that it couldn't be changed and that it would hurt us to change it. But yeah, maybe it's slightly red herring to call that innateness. Yeah, but I need to figure out what the better word would be. Yeah, thank you. That's really helpful.
Okay, I can see Celia next. Celia?
Could you comment on the idea of transition as being in itself a conversion therapy for children who are same-sex attracted and gender non-conformist in an attempt to fit the child into the heterosexual norm?
Yeah, so I've come across some interesting stuff on this. One paper that I read yesterday I thought was very revealing, although it was 1995 that it was written, so there might be more recent literature and then I need to update things. But that paper was actually claiming that they weren't talking about us because they didn't know we're coming, but our common belief as gender critical people is that there's a particular behavior in childhood, and that behavior is highly we think that that person's probably going to grow up to be gay, right? So feminine boys in early childhood, we tend to run the narrative that's a strong predictor of adult homosexuality. And so you would be like misdirecting that child to tell him that he was really trans rather than really gay, or at least there's a high risk that if there's active channeling going on, you're sending him not only in the wrong direction, but in a more harmful direction objectively because of the medical dependency and the surgeries. This paper, fascinatingly to me, was saying that that's actually a mistake. There's a diagnostic difference, if the clinicians are careful, between mere gender nonconformity in childhood, so effeminate boys, and the strength and intensity of gender nonconformity and cross-sex identification that would actually meet the diagnostic criteria for gender identity disorder. So they were saying it's not one cohort that could go either way depending on our cultural response. It's like different cohorts if the clinicians are careful enough about how they approach this gender nonconformity. So I found that really interesting because it undermined one of my assumptions about what our arguments are in the space of like being careful about transing away the gays, right? But take that with a grain of salt, because again, as I said, 1995, so a lot could have happened since then, and so I still need to follow all that up.
Yeah, particularly because probably 1995 it was concentrating on feminine boys.
Yeah.
But the big, what seems to be happening at the moment is
Girls.
the transitioning of gender non-conforming girls.
Yeah.
Who have a look at what it's like to grow up in this world as a woman and say they don't want it.
Yeah. Yeah, and I mean I think that's a good point. Of course, this paper was talking about very strong, like 2-year-olds, like in behaving in very like gender atypical ways for their age, and that is such a different cohort of people than what we're seeing today, right? So teenage onset or 20s and 30s onset gender identity claims, like arguably that's just a completely different pathway and phenomenon. And then I think we would be on much firmer ground, of course, bringing in the social arguments or saying that person's really a lesbian, but the society is not allowing the expression of that, or that's a person who wants to escape from sexual objectification and pornification, right? So all those arguments can come in there that couldn't have come in for the 2-year-old who's like strongly gender nonconforming.
Okay, Deb Downs. Hello, Deb.
Right. Sorry, needed to unmute my end.
Hi.
Yeah.
Hi. So I'm listening to this conversation. I'm thinking at the moment you have a whole cohort sort of around the world of lesbians and gay men and bisexuals who are not tainted by trans ideology, right? So, for example, I came out in the late 70s, but, you know, I was a lesbian from a very early age. And I know plenty of women like that, okay? So is there any value in gathering data by utilising organisations that can help, like, reduce the cost of that, and gathering sort of information about gender nonconformity? Because, well, I hear that the diagnostics for children is things like, you know, whether they play with boy toys or girl toys. And
Yeah.
many of us know that, you know, I'm of an older generation, and I had a library of Matchbox cars and dead Barbie dolls because I didn't like them. So I kind of think, while you've still got this sort of like untainted data, it might be worthwhile investing some time, because I'm sure people would volunteer to do a survey or whatever. It just needs to be designed. That was just the point I wanted to make, because it might help about the innateness or not.
Yeah. No, I think that's good. There's certainly, like, my guard has been raised in some of what I'm reading, because it's really like looking for a genetic explanation of, and then it's just like gender atypicality. And of course, as a feminist, you think that's not a mystery that needs a genetic or a prenatal solution. That's just like normal human variation. So there are these sort of like alarm bells at certain papers, and maybe the worst actually was one of the ones in the genetic category, this Bisterfeld, that the paper was arguing that the first of the blue ones in the middle here, that paper was arguing that girls tend to be underdiagnosed for gender identity disorder because society is less accepting of boys' gender atypicality. But instead of saying, so we need to be more accepting of boys' atypicality, they argued we need to diagnose girls more. So it was like, again, I don't know if that's just like clash of worldviews reading that as a feminist, but I find it really horrifying. So I think you're right that more work into like what is normal variation rather than what should be like a mystery to be solved by science.
In my family, we've got 2 girls and we've got 2 lesbians, right? Both quite intelligent, well educated, went through different paths in life. But I think it's really important for girls and, you know, like men and women, to explore the differences about sexual orientation. Because I think it is innate, but there's no proof, and I don't know anyone that can actually prove it. But I'm really upset about what's happening to, you know, gender non-conforming kids.
Yeah, no, me too.
I take Gillian Spencer next. Gillian.
Oh, just me again. Sorry, I'm back. And I guess part of the research, like we all want to do research to try and help this situation go away. But one thing I've had to come to terms with as someone who works in a hospital where there is a gender clinic is that actually everyone knows that that the research is poor, and that, you know, for example, gay kids are more likely to exhibit non-gender conforming behaviour. And I've had to come to terms with the fact that everyone knows, but it's still not changing.
Oh, wow.
I guess it's a blow. But I just wondered if you had any thoughts about that. But then I do see that you've got to keep researching and pushing the point, and that this is a mechanism for just trying to keep sort of like, you know, battering ram, just keep going and finding new angles to keep pushing. So is that sort of, I don't know, what are your thoughts about that?
I guess I'm surprised. Yeah, I'm surprised to hear that everyone knows, because it feels like this has been such a recent victory, right? Like there's so many different. I mean, that's playing out in Australia and very unsuccessfully. You've had a lot more success in the UK. But yeah, that it's quite a recent victory that like people know, or like enough kind of clinicians have started speaking out, or there's like a popular podcast now and there's GenSpect, and yeah, it feels like such a recent victory that I wouldn't expect to see a lot of change yet. And so in that respect, I'm sort of still probably fairly optimistic that like as the word spreads more and more pressure is brought to bear and different like experts of different kinds like get the confidence to join in, that actually this stuff will slowly change.
Oh, yeah, maybe people have to get to the point where they can't pretend they don't know, where they're still in the stage where they can pretend they don't know.
Yeah.
Maybe all the clinicians don't know, but I know the psychiatrists know.
Yeah, right. No, and I think, I mean, it's been a hard lesson to learn, and probably a lot of people in this audience feel that way, like being gender critical, because you see how cowardly a lot of people are, like that could be joining and could be contributing useful skills and are totally on side, but just they want an easy life, right? And that's kind of rational. Like it is unpleasant. It's deeply unpleasant. A lot of us have had deeply unpleasant experiences, but it's also a really high stakes situation. So yeah.
We're running a bit short of time. I've got Christina and Gina Moore. Christina first.
Hi, Holly. I
Hi.
just wondered whether you'd come or thought much about the fact that the accessibility and I suppose normalcy of pornography has anything to do with this. So particularly I've been looking at people writing about the information available in schools and how we're getting more and more tolerant, I suppose, of fairly sexually explicit material being presented under the umbrella of being inclusive. And whether that access to the internet, access to things like TikTok, that there's a huge social element of this that's also to do with, and porn I would suspect be far more invasive for females, and it's females that seem to be surprisingly expressing gender dysphoria at the moment.
Yeah, but do you mean as a social explanation? Because I think that's plausible. Like porn can be playing...
Yes, as a social explanation, and also as a pressure to experiment and that to be seen as normal, and therefore if you like this,
right,
pressure to say that you like it, and if you like it then you fit this category or that category.
Yeah, no, I think that's interesting, and I certainly think that the sort of porn and the sexualization of women and the sort of expectations that there are now around casualized sex, I think all that is interesting in terms of explanations. I guess this is just like it's a different kind of project to that. It's almost trying to find out like the best case for our opponents would be if this stuff is like innate in some way and is sanitized, right, in a way that gets them to escape the sort of autokindophilia issues. So I'm like almost, this is as charitable as I could possibly be. I'm going to see if it's right. Obviously, it probably turns out that it isn't. Then the path is clear. And then, yeah, you're right. Maybe we need a whole different set of explanations of what is really going on with this like huge rise and change in the sort of demographics that are identifying as trans. This is just one particular sort of starting step of a project like that.
Okay, thank you.
Okay, Gina Moore.
Hi, thanks, and sorry I was late. Thanks, Holly, for your presentation, what I did get to see, but really interesting. I think I was just really remarking on the comment before the last speaker about people knowing and people being prepared to speak up, and I think it's a really important element to the multi-prong approach to what we're all working on, or many of us are working on. And I might happen to work for a large medical organisation in this country that has both national and state branches, and I'm aware that the national branch claims to support the ideology and our state branch doesn't, but not really openly. But I know that they don't.
Yeah.
And that they did make attempts to object to the Victorian legislation and were pretty rapidly shut down. I think it surprises me, and I think it's one of the key elements that the medical area really need to stand up. And I guess there's a question about how I try whenever I can with my job to push things, but you know, that's fairly minor. You know, I think it's a question, how do we get the medical profession, because that's going to be one of the keys. You know, everyone talks about it's the lobotomy of the current age, and it's just so critical what's being done to kids. And do we have to wait? Do we have to wait to have a generation of sterilised and sexually dysfunctional children? Do we really have to wait for that? How do we get these doctors to speak up?
Yeah.
It's thinking out loud, not expecting you to have an answer to that. But yeah.
No, I mean, the only thing that occurred to me is that like the recent media attention on Unimalbs seems to have had an interesting effect on Unimalbs' willingness to step up their game a little bit. So I'm wondering if that's a route, like maybe medical people, we get the journalists involved first, and that brings enough public pressure that the medical people respond. So maybe there are some alternative pathways like that make it more likely. But Mark, did you want to respond to Gina?
Go ahead, Mark.
You're still muted. Yeah. Oh, you unmuted momentarily.
Great. Sorry. Yeah. No, I wasn't responding to that. I just wanted to ask a further question. It was just picking up on what you'd said about being as charitable as possible to the other side. It is possible to argue that even if practically everybody has a mosaic, as the neuroscientists are finding, of male and female and non-sexed brain features, it is possible for the other side to say, well, look, yes, that is true, but at the extremes of the distribution, there are actually people who have what could be called a female brain or a male brain. And I'm just wondering, A, what we say to that, and B, is it just a case then of saying, well, look, that's like saying a 4-foot man who is closer to the average female height than the average male height is still, you know, irrespective of the height and of the average differences and being an extreme of the distribution, still remains a man, still remains male and a man.
Yeah. No, I think that's exactly right. I mean, I just can't see how you can get an argument going. You know, of course it would work if there were literally two types and then trans people had the other type. But if it's just a large overlapping distribution, it just seems strange to me to say that therefore that male is innately female, but not all the rest of the males that have a more feminine brain than him. It's just, the argument's about the brain and what it justifies. So yeah, I don't think they're going to get much traction out of that. And I don't even see how they could, even if it turned out that one transsexual had like the most female typical possible brain. Yeah.
Thank you. Is there anything you want to say by way of summing up, Holly? And we are slightly over time, but if you just wanted to say some, finish off. Sorry, I can't take any more questions because we have to close.
No, I don't have anything. I'm really grateful that people came, and it's been nice. Thanks for not screaming and disrupting the session. That was unexpected.
Thanks, Holly. It's it's very good to have you here, and thanks for your talk. I think on this occasion I want to express, I don't want to sort of put words into everyone's mouth, but I want to express support and solidarity for your position at the University of Melbourne as well.
Thank you.
And you know, for the quality of the work and the importance that you work of the work that you do. We are all extremely in your debt. I'm going to close the meeting now. If you want to get in contact for our next meeting, you can find us on Twitter. You can find us at the Open University website.